Influenza, or the flu, isn't just a bad cold or a few sick days on the couch. It's a highly contagious respiratory virus that targets your lungs, nose, and throat, and it can turn deadly fast. Each year, it hospitalizes hundreds of thousands and kills tens of thousands in the US alone. And no, that's not a scare tactic. That's your annual reality check. You don't catch the flu from licking doorknobs. Just being near someone who coughs, sneezes, or even talks can send virus-filled droplets right into your airspace. You breathe them in, you touch your face. And suddenly, you're not just dealing with a sore throat. You're in bed for a week wondering if you're coming out the other side. Symptoms hit hard and fast: high fever, chills, hacking cough, runny nose, fatigue that feels like you're walking through cement. For most people, it's awful, but survivable. But for older adults and anyone with existing health conditions, the flu is a loaded gun. Let's talk numbers, because the body doesn't lie. After a confirmed flu infection, the risk of heart attack spikes sixfold in the following week. Let that sink in. Even if you've never had heart issues before, your chance of experiencing a cardiac event shoots up dramatically just from catching the flu. The mechanism? Inflammation. When your immune system launches its all-out defense against the virus, it sets off a cascade of biological stress. Your blood vessels inflame, plaques destabilize, clotting factors surge. If you've got any underlying cardiovascular weakness, even hidden, the flu can be the trigger that brings it all crashing down. That's why older adults are at the top of the risk pyramid. As we age, the immune system weakens, a process known as immunosenescence, and chronic conditions like diabetes, COPD, hypertension, and kidney disease compound the problem. The body simply can't mount the same efficient, coordinated response it once did. What would have been a mild illness at 35 becomes a full-body siege at 70. But here's the good news. There's a way to diffuse the threat. The power of prevention. Why the flu vaccine works. The flu vaccine isn't perfect, but it doesn't need to be. What it does do is drastically reduce your risk of serious illness, hospitalization, and death. That's the goal. Not necessarily total flu avoidance, but survivability. And for older adults, there are 3 preferential vaccines that offer better protection than the standard flu shot. High-dose flu vaccine contains 4 times the antigen, the substance that sparks an immune response, compared to a regular dose. This gives older immune systems a stronger nudge to create protective antibodies. Recombinant flu vaccine uses DNA-based technology instead of eggs to manufacture the vaccine. This allows for a more precise match to circulating flu strains and is ideal for people with egg allergies. Adjuvanted flu vaccine includes an immune-enhancing ingredient called an adjuvant. This helps stimulate a stronger response with a standard dose, acting like a megaphone to your immune system. These vaccines are specifically engineered for the challenges of aging immunity. They've been tested, peer-reviewed, and updated annually to target the most likely flu strains. In clinical trials, they've consistently shown better effectiveness in reducing severe outcomes in adults over 65. Let's be crystal clear. The flu shot cannot give you the flu. You're not being injected with a live virus. If you feel a little achy or tired after the shot, it's your body gearing up, building the cellular army it needs to defend against the real thing. That's a good sign. What about side effects? Sure, some people experience mild side effects like muscle aches, low-grade fever, or soreness at the injection site. But those symptoms pale in comparison to what the flu itself brings. A few days of arm soreness versus 10 days of fever, fatigue, and potential organ complications. That's an easy trade. Serious side effects are extremely rare, and the benefits of vaccination far outweigh the risks, especially for older adults. What if I miss the best vaccine? Get whatever is available, The worst vaccine is no vaccine. While the three preferential types offer more robust protection, any flu shot is better than none, and all of them are safe. If you're unsure which type you should get, ask your healthcare provider. They'll take into account your age, health conditions, and past vaccination history to make a recommendation. You can double up. Yes, you can get other vaccines at the same time as the flu shot, including COVID-19 boosters, pneumonia, like Prevnar 20, or shingles, Shingrix. These combinations are well studied and shown to be safe and effective when co-administered. You don't have to schedule 5 appointments. You can get protected all at once. Access is easier than ever. You can get vaccinated at your doctor's office, your pharmacy, a local clinic, a community health event, or even at some workplaces. No appointments needed in many cases. No excuses. And if you have Medicare or private insurance, the flu shot is covered 100%. No out-of-pocket cost. So the only cost of skipping it is the risk you're taking on. And that cost can be steep. Already feeling sick? If you develop symptoms, fever, chills, cough, body aches, don't assume it's just a cold. Call your doctor. Get tested. It could be flu, RSV, COVID, or something else entirely. Early diagnosis means early treatment, which can blunt the severity of symptoms and reduce complications. If you do have the flu, stay home. Rest. Hydrate. Keep away from others. Cover your mouth when you cough or sneeze. And if you're older or immunocompromised, ask your doctor about antiviral medications like oseltamivir, Tamiflu. They can reduce the duration and intensity of the illness if taken early. Warning signs you shouldn't ignore. Call 911 or seek immediate care if you experience trouble breathing, chest pain or pressure, sudden confusion or dizziness, a high fever that doesn't break, blue lips or fingertips, inability to stay awake. These may be signs of severe flu complications like pneumonia, sepsis, or even a cardiac event. Don't wait. Bottom line. The flu is not just a seasonal nuisance. It's a serious, sometimes deadly threat, especially for adults over 60. But it's also one of the few major health threats that we can prepare for and reduce with one simple step: vaccination. This fall, don't put it off. Get the shot. Encourage your spouse, your parents, your neighbors. Be the reason someone you love doesn't end up in the hospital, because the flu will come, but how hard it hits is up to you. Thank you for watching. Remember to take care of each other and be well.